We need to start thinking beyond chemotherapy or beyond treatments that are producing nausea and vomiting, because it's a more multifactorial symptom, side effect. So risk factors will play a big role. The same patient receiving the same chemotherapy, for example, might have more or less nausea and vomiting compared to another patient receiving the same type of treatment and the same diagnosis. So risk factors make a difference. And that might be being female. Younger patients tend to vomit more than older. If you feel anxious about your treatment, almost by definition you will vomit. If you expect that you will vomit, almost by definition you will vomit. So we need to start thinking about, it's not just the chemotherapy or radiotherapy, but we need to go beyond that and see what else we can do about that. So one of the pathways for nausea and vomiting is the higher brain center. And that has to do with memory, with past experiences, coming back and connected with chemotherapy. And this pathway is not really managed well with typical antiemetics. We need something different. So now we're moving to combining different antiemetics depending on the risk factors of each individual patient to produce a better result. The guideline is something that MASCC has been doing for the last 15, 17 years. We are in the fourth update of the guidelines. So every time there is new knowledge and new information, new evidence, we're updating the guidelines to reflect current practice and current knowledge. So this year, 2 months ago, we published our update guidelines, and we're recommending certain new drugs to be added to the combinations, to the older combinations, because they make a better difference. I mentioned before about the NK1 receptor antagonists. This is the new generation of and a new pathway for managing nausea and vomiting, and we have, as I mentioned, 3 of those at the moment. So they're coming into the combination that we used to have of 2 antiemetics. So in highly emetogenic chemotherapy, now we're recommending 3 drugs and possibly 4. There's another old but new drug, old because it's been an antipsychotic for 40 years, we know it, but actually we've seen that it makes a big difference for nausea, and we are also recommending that to be added for patients that have an experience of this particular problem.